Bismillah ar-Rahman ar-Rahim. Bismillah walhamdulillah wa salatu wa salamu ala rasulillahi sallallahu alayhi wa sallam. Amma ba'd. Rabbi shrah li sadri wa yassir li amri wa hlul uqdatan min lisani yafqahu qawli. Allahumma salli ala Sayyidina Muhammad wa ala ali Sayyidina Muhammadin wa barik wa sallim. We begin in the name of Allah and we send blessings and salutations on our beloved Prophet Muhammad sallallahu alayhi wa sallam. Alhamdulillah, tonight we have an amazing program with our beloved Dr. Arif Shoaib, mashallah, who's been doing many programs for the last few years for our community. May Allah subhanahu wa ta'ala accept and may Allah subhanahu wa ta'ala bless him, mashallah, for every time we reach out to him to do such programs for the community, he always, mashallah, responds and he always agrees to it, mashallah. Jazakumullah khair, Dr. Saab, and tonight we have a really good topic, inshallah. And we plan to cover this topic over the next, not just immediately the week after, but in a span of 2 to 3 weeks, inshallah, because we have other programs that we need to accommodate every Friday and every now and then as well. So this is going to be the first part of the program that we will be doing. The title of this program and the topic is Mindful Muslim. And today, inshallah, we will be covering emotional well-being and mental clarity. This is a problem that is really or rarely discussed. We don't really talk about these kind of topics because they're not considered very topics. People really don't get into it. It's just that pretty much everyone is involved in it. They're suffering, they're going through it, but no one really addresses or talks about it because it's not a very common topic. It's something that's not really taken very seriously, especially from the cultures that we come from. Especially in the cultures that we come from, it's something that, that's almost not just taken seriously, but something that's looked down upon. Something that's looked down upon that something's wrong, something's mentally wrong with that person. But the truth is that most of us, if not all of us, are in some way, form, or shape are struggling with this type of problem. And to add to that, we live in an era where there's so much distraction and so much fitna around us that it doesn't help. It makes it worse. It makes it worse. Now tonight, inshallah, the goal is to not drag the program for too long, inshallah, but rather to go into the psychological part of it and the Islamic part of it as well, inshallah. And Dr. Saab has prepared a PowerPoint presentation, mashallah. And we'll start right away because that's really the crux or the meat of the presentation. And then inshallah, if he allows me or leaves some time for me, then I might share some insights as well, inshallah. So without any further delay, I'm going to pass on the mic to Dr. Arif Shoaib, inshallah. He is a known, established psychiatrist who has his own practice right here in Sugarland. And his practice extends to many hospitals in the area, mashallah. And he's been serving the community, everyone, mashallah, for many, many years, mashallah. May Allah subhanahu wa ta'ala bless him, inshallah. Start right
away. Sheikh, thank you very much for such a nice introduction. Thanks to the team for getting the PowerPoint up and running. I like to use PowerPoints because that way you can actually stay focused. If I just talk, I feel like people go to sleep. So, and it keeps changing the picture, so it keeps you occupied. Anyway, so let's get started. As Sheikh said that, we will be doing this program over 3 or 4 sessions. So this is the introductory session. We'll just talk about, emotional well-being, what's mental clarity, how we integrate spiritual as well as scientific approach. Of course, we don't need science to confirm what we know from our deen. And there's a lot of psychology in Quran, and there's a lot of psychology in our Prophet's dealings with the Muslims and Sahaba. So let's jump right into it. Okay, so changing over there now. All right, so what's emotional well-being and mental clarity? I mean, so let's talk about emotions, right? We all feel emotions. I mean, I don't think that there's anybody in this room that has not felt emotions. I mean, we have always experienced happiness, sadness, anger, anxiety, depending on what situation is, and depending on how long they last, it can affect our minds and our bodies and our relationships. If we don't get a hold of it or don't control it. So, emotional well-being is basically the capacity to manage emotions and sustain a positive mindset. Now, think about it. As you are feeling very angry about something or very upset about something, and you still are able to maintain your emotion, then you can keep your mind intact. As they say, that when you are very angry or very happy, don't make any major decisions in life, right? So that means that you have to be at an even keel in your mind to be able to make important decisions in life. So what happens is if we are able to maintain our emotions, we can actually be more resilient person, more mindful person. We can actually think through any trouble or any problem. I mean, if you think about it, when you are really upset about something or hear the news and you have to make a decision, sometimes you don't make the best decisions, right? So it can impact the quality of your life. If you're able to keep it cool, you're going to have good quality. If you're not, then you're going to make decisions that you'll regret later on. And Sheikh can actually give examples of that probably later. All right. So what happens when we are stressed out? When our emotions are extremes, right? So it causes stress. What does stress do? It disrupts the balance of the neurotransmitters. So our brains are like these machines that are very finely tuned. There are so many different chemicals that we can't even count all of them, and they all interact in ways that we can't imagine. It's amazing that all of us are not, all of us make it to this level in life. The kind of assaults we experience from the time of inception till we end up dying. So it's amazing, how we survive that. So anyway, so these neurotransmitters, if there is consistent long-term damage or stress, can actually cause damage to the brain. So the neurons are basically the wiring of your brain that carry signals from one place to another. So when the neurotransmitters are off for a long time, those wirings can actually get burnt. So when they get burnt, what happens? The signals don't travel anymore. So then people start developing diseases, which could be anxiety, which could be depression, which could be PTSD, which could be obsessive compulsive disorder. I mean, you name it, they happen because of the neurotransmitters imbalance. So what do we do in psychiatry? We treat it. How do we treat it? With medications. So when the neurochemicals are off, we give medications, which are chemicals, to put them back in place. Some people need it long term, some people don't. All right. So like I said, that if you continue to stress the body, now the stress can affect all parts of the body, right? It can cause heart problems, such as elevated blood pressure. A lot of people, when they're very anxious, they'll notice their blood pressure goes up. If you do breathing exercises, you can actually bring it down without taking any medication. But what does that mean? That means you are controlling your emotion. You're changing your mindset, right? So you're controlling that, and that helps. Now, if the body continues to be under stress, it can cause inflammation. Inflammation causes damage to the blood vessels. So chronic stress, you have heard that people who have chronic stress, they end up getting heart attacks. Why? Because chronic stress causes hormones and neurochemicals that it produces. Cortisol is the main culprit, actually. And you'll notice, you'll see that, as I speak, we'll talk about cortisol and its involvement in different, diseases, right? So increased cortisol causes damage to the body, right? Then when people are under stress, what do? They eat unhealthy food. They are not mindful of what they're eating. They feel very hungry all the time. Stress causes people to eat sometimes. So people who are very anxious or very depressed, they'll go one way or the other. Either they will not eat and lose a lot of weight, or they'll eat substantially more food than they need, end up gaining weight, which of course leads to other health problems. Stress causes sleep problems. Anybody over here who's never been stressed to the point where their sleep was disrupted? Raise your hand. So there are very few people who have not experienced stress that does not cause them to sleep at night. You know, you could be excited about something that even causes stress. You could be sad, you could be worried, waiting for your results, waiting for a job offer, waiting to hear from someone. Or you propose to someone, now you're waiting for a response, right? So that's going to keep you from sleeping. But then, anyway, so it causes hormonal disruption, which is, again, affecting the cortisol, which affects the sleep cycle itself. So you're not able to sleep through the night. You may have difficulty going to sleep, or you may be able to go to sleep, but then wake up several times in the middle of the night. So in the morning, you're tired. When you're not sleeping enough, that causes other problems. Then you have difficulty focusing in the morning. You cannot concentrate. Anxiety also causes problems with memory. Why? Because your mind is always running but cannot focus on any one particular thing. So you could be sitting in a class thinking about something else and nothing is going in. You come out of the class, what do you remember? Nothing. All right. What else does stress do? It causes muscle tension. So when you're very stressed out about something, you'll notice that you'll be carrying it either on your shoulders or your back. And you will notice that a lot of times people who have a lot of stress, they will complain of body aches. You know why? It's like starting a car and not moving it. Let it run all day long. At the end of the day, what happens? You have burned some gas, right? How much work have you done? Zero. Car hasn't moved. The same happens in anxiety and stress when your muscles are tight, that they are so tight that they start burning energy. At the end of the day, there's lactic acid, which is a byproduct that gets stored in the muscles and it hurts. People have knots in their muscles, So that again is stress. It causes chronic pain. People who have migraine headaches, they get worse. People who have other conditions, rheumatological conditions, their pain can get worse, right? Other musculoskeletal problems, like, people who have back issues, they will aggravate because the muscles are so tight. Okay, so the muscles can get in spasms because of the stress. All right, so now too much cortisol can affect your immunity. People who are depressed, people who are chronically anxious tend to get sick more often with viral infections, bacterial infections. Why? Because the immune system goes down. It directly affects their white blood cells, which are the cells that fight infections, right? And then, because their immune system is down, when they get sick, their recovery takes longer. So then a person who is not under stress. All right, what else can it do? Stress also affects the reproductive health. People have difficult, people who are, I don't know how many times you have heard, but I have seen it several times, people who are trying to get pregnant. They can't get pregnant. They're stressed out because they're trying so hard. And then when they stop trying, guess what? It happens. They get pregnant. It affects men and women. Menstrual problems, with men, other problems, libido problems. So stress affects, of course, and then it's going to affect the relationship between husband and wife, because the stress is causing them to not have the desire, to be intimate with their spouse. So then that leads to other problems in their lives, right? All right, so what is mental clarity, right, and cognitive health? Mental clarity is when you can actually think clearly about something without getting emotional and think through things, which again requires for you to have very calm personality. We all can have calm personality, but it depends on how we deal with the stress, right? Okay, so clear thinking and focus, sharp cognitive abilities, which we all desire. Why is it important in life? Clear thinking supports better decision making, right? Like I said, like when you are calm in your thought process, you can actually make good decisions. How do you improve that, right? Again, like how do you improve your mental clearance and performance? By, again, controlling your emotions. So, I can't emphasize enough how important it is for us to control our emotions. When Prophet ﷺ said, right, and Sheikh can correct me if I'm wrong, that when you're upset, you're standing, sit down. If sitting down, lay down. Or, go wash your face or make wudu, right? Why? You change your mindset at that time. You're doing something different from what that was bothering you, right? So you take your mind off of the problem. All right. So the connection between emotions and thoughts, right? So thoughts are affected by emotions, and emotions in turn affect our behavior, right? So having a positive thought process is going to help us feel better. Having a negative thought process, you have something that happens to you, somebody upset you, and you just keep thinking about it over and over in your head. What's going to happen? You're going to get angry. And you're going to get angrier. So next time when you see them, you may just blow up at them, right? So that's why there's such a high emphasis in our deen on forgiveness. When you forgive, your heart gets clean. You don't mull over the same thing over and over again. You let it go, right? So then when you let it go, then you are able to calm yourself down. You're not going to run your blood pressure up. I may upset you, and you keep worrying about that. I don't realize it. I don't even think about it. But your blood pressure keeps going up because I said something to you that you can't get out of your head. And that's also a reason that, our deen tells us to be very kind to each other, use the best words possible when we communicate with each other, because shaitan is always sitting there to try and create fitna. All right. So it's very important that we filter our thoughts. What does that mean? What that means is that when a negative, all of us get thoughts, different thoughts, some good, some bad, some negative, some positive. So the negative thoughts that come through our mind, we have to learn to filter them, put them aside so that we don't think about them. The less we think about them, the better off we are emotionally, right? Okay. So I'm just going to touch a little bit on Islamic teachings on emotional well-being. And of course, Sheikh is the one who's going to talk more into detail. So as they say, patience is a virtue, right? Why? Patience is highlighted in Quran and Hadith, right? It's very, very important when you're going through hardship. Why? Because when you're patient, you can go through anything without losing faith. But it's so important to stick to the faith. Patience goes right along with that. Expressing gratitude. Gratitude meaning being thankful for what Allah subhanahu wa ta'ala has given us, right? So if I'm thankful for what I have, I am focused on being positive, right? I'm not focused. I have to focus on what I have, alhamdulillah, right? I could be worse than that, right? If I keep looking at the guy above me or person above me who has more than me, then I will be thinking negatively again. Jealousy and all that comes through that, right? So being grateful for what you have actually helps you, again, control your emotions. Trust in Allah subhanahu wa ta'ala. Place trust in Allah provides strength and comfort, right? Look at people on Gaza. They are the best example that you can use for patience, sabr, right? Their faith in Allah subhanahu wa ta'ala, it's amazing. If it was anyone else, they would have run away from there. But they're not leaving, right? Because they have faith in Allah subhanahu wa ta'ala. All right. So spiritual practices, that we can use for emotional resilience, right? To be strong emotionally. Prayer, first and foremost, for calmness. Prophet ﷺ used to pray whenever he wanted to be calm, when he wanted sakina, right? May Allah subhanahu give us the ability to do that as well. At least I can say for myself, a lot of time when I'm praying, my mind is somewhere else. It's very hard to find that. Once you find that clarity, and I can tell you a few times when you do find that clarity, your heart is so much at peace, so much at rest. You enjoy that salah, right? Okay, so the dhikr. The other thing is like when you're traveling, let's say you're driving or you are, whatever situation, you do dhikr. keeps your tongue busy with Allah's dhikr, and that helps you kind of stay actually calm too. Reflection and resilience. Reflection, is very important as well, that we don't think about a lot of times. When you just sit down and think about how your day was, what transpired in the day, not thinking what somebody else did to you, but thinking what I could have done differently. If something negative happened, what could have I done differently to avoid that from happening or prevent that from happening? And what can I do to keep it from happening again? Right? Husband and wives argue all the time. Okay, so if each person sticks to their guns and says, I'm right and they're wrong, what's going to happen? But if each person is willing to forego their right, even if they're in the right, if they're willing to forego and forgive, guess what? There's going to be sukoon in the household, right? So it's very important to reflect upon our own behaviors. All right, so role of faith and gratitude in prayer and fostering well-being. So why is it important? Faith and hope, of course, as I said, Iman, nurtures the hope and gives life a deeper meaning, deeper sense of purpose, right? My sense of purpose is not that, okay, I get up in the morning, I go to work, come home, eat, and go to sleep. What have I done? I'm no different than an animal. They do the same thing, right? My sense of purpose should be different. And that is something that we all have to identify. Not everybody is going to be a leader, but we all are leaders in our own households. We are leading someone, believe me. As an adult, there are younger people who are looking at us and following us. Children will follow you, what you do, not what you say. If a father smokes, child will smoke, no matter how much you tell him not to smoke, right? Okay, so gratitude also enhances positivity. Like I said earlier, that when you're thankful for what you have and you think about it and you are content with it, your heart is going to be at ease. You're not going to be competing with other people, right? You don't want to be like someone else. You're happy with who you are. And of course, prayers provide comfort. When you're stressed out, go pray. We do nafils. We ask Allah subhanahu wa ta'ala for guidance, right? That's prayer. So some psychological principles that we use for mental clarity, right? So identifying unhelpful thoughts. If I am going through negative thoughts, if something is happening at work, for instance, I'm stressed out and I think, oh my God, my boss is treating me so bad and they're treating the other person so well, right? So that thought process is going to make me act in a way that is going to hurt me in the long run. I may be unnice to my boss, unthankful to them, and maybe nothing is happening. It's just in my mind, right? If two people are for promotion, one gets the promotion, the other one doesn't. They only have one spot. So the one that doesn't get it does not mean that they're bad or they're worse off or boss doesn't like them. Maybe the other person has some extra, better qualities, or maybe they're better qualified. And then, so how do you modify the thought patterns, right? We can modify our thinking. That's the only thing we can do. The only person we can control is ourselves. We can't change anybody else. You can't change your wife. You can't change your husband. You can't change your kids. We can only advise other people. But the only person we can change is ourselves. That we can do, right? So, but how, again, the actions come from the thoughts. Thoughts become speech, and then that leads to actions, right? So the very important thing is it's called cognitive behavioral therapy method, where you actually take the negative thoughts and replace them with the positive thought. If you think, oh my God, people who are depressed, there's nothing in the world that will make them think they are good. In their mind, they're the worst off people. They're worse people. They need, deserve punishment, and what they're getting is some punishment or something. Not true. Depression has nothing to do with what you do. Depression has to do with your brain chemicals. Can stress lead to depression? Yes, of course. But is depression there because you did something wrong? Not necessarily, unless you did something really, really wrong. Even then, you can ask Allah subhanahu wa ta'ala for forgiveness. All right, so you change that thought process, you own thinking. For instance, like let's say you have a negative thought. And what you're going to do, you're going to take that negative thought and find reasons why it is wrong in your mind. Somebody may think, oh, I'm ugly. Okay? Look at the mirror. Think about it. Ask people. Ask your mother. She will never find you ugly for sure. But that's just a thought. You find reasons like, okay, I have this positive, so this is not true. But again, as I said, like when people are depressed, they have a very difficult time doing so. So these techniques help thinking clearly and positively, which of course affects your life in general. All right, so emotional regulation, stress management strategies. What can you do? Deep breathing. I have tried it and it works. When you're stressed out, stop yourself from doing whatever you're doing, take your focus away, close your eyes, take a deep breath, hold it to 5, and breathe out over 5 seconds. Do this 10 times, you will notice your blood pressure actually will come down. Your heart rate will come down. Okay? The problem is that our lives are such, like Sheikh said, we live in a time of fitna. Our life is such that we don't have time to breathe. People don't breathe. When you're talking, you're not breathing. When you're eating, you're not breathing. The only time you're breathing is when you're sleeping. And if you snore, that's a bigger problem. So, anyways, another thing that can help is sometimes journaling. Because when you're anxious, when you're concerned, when you're worried, what happens? You have too many thoughts going through your head too fast. So you can't find an end. If you can find an end and then undo one thing at a time, that's the best thing to do, right? But most people can't. So journaling, you write down your thoughts. So when you start writing down what's going to happen, you're not going to write down everything that's going through your head. You're going to take one thought, write it down, then you go to the next thought. What does that do? That slows your mind down. That you're just running like 100 miles an hour that you don't need. And then relaxation exercise, like I said, there's specific exercises that you can actually learn and practice where you release your muscle tension. So that also is a way to kind of reduce your stress. Thank you, Sheikh. All right. So mindfulness and self-awareness in psychology, what does that mean? So mindfulness encourages focus on the present moment. You're not thinking about what happened yesterday, and you're not thinking about what's going to happen tomorrow. Where am I right now? What am I doing right now? What am I looking at right now? That is what you do. So that could pertain to your work, could pertain to your relationship, your conversation, your salah. Actually, mindfulness helps, when we focus on what we are saying in our salah, that helps us, right? Emotional regulation, practicing mindfulness actually decreases anxiety, decreases stress. Self-acceptance, which means like, I am who I am, accepting who we are. That helps, right? Contentness. And then thoughtful responses. Self-awareness also helps. When you are talking to people, you don't hurry up and, a lot of time when you are talking to people, you will see that they're not listening to you, but they're thinking of a response, right? We all do that. It's not, we all do that. But if you actually stop and listen, that was one of the things Prophet ﷺ used to do. He used to listen to people. Everybody that he dealt with thought that they were the dearest person to him, ﷺ, right? Why? Because he was a very good listener. So when you listen to other people, you are helping them and helping yourself. Now you can actually help give them an answer. You know why quacks are so successful? Right? Because quacks listen to people. Nowadays, doctors don't have much time. They're jumping from one patient to another. They don't have time to listen to patients. So quacks have a lot of time. They sit, they listen. Half of the problems are gone when somebody's just kind of coming and, it's cathartic to be able to talk about what their problem is. So it's very, very important to be able to kind of stop, slow down yourself, listen to people, and respond accordingly. All right, so how do we integrate the two things? Like, bringing psychology and Islam together, right? So mindfulness, like I mentioned, that you use that. Meditation, other people use yoga and other kinds of meditation. Our salah is our best meditation, right? So if you're mindful in your salah, you are focused on your salah, focus on Allah subhanahu wa ta'ala, focus on what you are saying, that will help you remove from the world. Where do the problems come from? The world around us, right? You got to pay the bills. You got some job issue going on, something going on with the kids, something with their school. Something's going on always, and that's part of life. If somebody says they have no stress in life, well, they're not telling the truth. But how you manage the stress is what's important. All right. So, like I said earlier, that staying emotionally calm is very important. Having mental clarity when you go to Salah is very important. So, how do you build resilience through the faith and therapy? Right. So, faith offers individual meaning, hope, and sense of purpose during difficult times. People who don't believe in God or deity, they have a very difficult time going through life because they think that they are responsible for everything. As a Muslim, we know that we are not. Our risk is written, everything is written, everything bad that happens has a purpose behind it, right? So we know that. So that gives us hope, that helps us. But a lot of times we don't rely on that. We lose sight of that, unfortunately. Therapy and coping. Therapy is very important. People think therapy is for crazy people. Crazy people actually can't do therapy. People who are totally out of their mind, who are delusional and hallucinating, they cannot do therapy. Okay? And crazy is not a good word to use anyways, but I hear it all the time. I'm not crazy. I don't have to go to a psychiatrist. No. You could be depressed. You could be anxious. You could be stressed out. Talking to someone other than your family, which could be the cause of your stress. So a neutral person who can actually help you think through things. I may be wrong in my thought process. I may be thinking that, I am right. I'm in the right. And I don't have to change my stance. But the therapist can help me figure it out where I am wrong. Like I said, the only person you can change is yourself, right? So when you combine the faith and therapy, it actually is very helpful. Nowadays, alhamdulillah, we have a lot of Muslim therapists. Initially, when I started practicing, we barely had 1 or 2 Muslim therapists. Now we have males as well as females. So, nobody can say, okay, well, I can't find a Muslim therapist. The reason it's important to have a Muslim therapist is they can understand your faith. They can understand cultural nuances, which a lot of the non-Muslim therapists can't. So they can actually help you a little bit better. But you can go to a non-Muslim therapist. A good therapist will be able to help you with any kind of problems. So, supportive communities like our community over here, mashallah, is very supportive. People get together. When you are with the community, people who are like you, it's much easier to actually to be able to find, friendships. When somebody moves into a new town, where's the best place they can go? Masjid, right? Find other people, find friends, find support. And like I said, counseling, we have already talked about. And then holistic well-being, it integrates all these things together. Basically, you're looking at everything. You're exercising. You're maybe taking care of your diet. You are, seeing a therapist if necessary. You're taking medication if you need to. There are some people who need to take medication for depression and anxiety, and some people take it for a short time and then they're, done. They're better and they don't need to take it. Other people have to take it long term. It all depends on what kind of stress they have and, what kind of issue that. Some of these disorders run in families. They're genetic. You can't control it. You can't change it, All right. So I think that's the end of my part. Now, Mike is yours, Sheikh. I hope I didn't take too much time.
Jazakumullah khair, Dr. Saab. Thank you, Dr. Saab, for the beautiful presentation. Very informative and very, mashallah, full of education and knowledge. May Allah subhanahu wa ta'ala bless you. Dr. Saab, Dr. Arif pretty much covered everything. You left nothing for me. He covered the Islamic part as well, mashallah. Just a little different approach. I do want to, I won't speak. I will just speak for like 5-10 minutes the most. And then inshallah, I want to open some floor for Q&A. I think most of the things that we really get to is during Q&A. So a lot of times people have questions. I have questions, right? So we can just ask this question because we have a professional in the house, inshallah, and we can try to address that. Just a different, Dr. Arif already covered the Islamic part, but just a different approach or take that I'll take. We hear this, that subhanAllah, in our religion, salah, prayer, dua, are coping mechanism for stress and anxiety. How about a person who says that, well, I've been praying, I've been making dua, I've been crying, I've been making dhikr adhkar, it hasn't been helping me. It hasn't helped. Everybody says that make dua, read salah and adhkar and this and that. Didn't really help me and hasn't been helping me, even though I'm actually praying more than I was praying before. Especially during this difficult time, I'm actually doing more. I'm trying to be a better person than I was before, but can't seem to get over it. Where's the problem? The problem, the answer to this is two. One, as Dr. Arif mentioned, that a lot of times the problem is not just necessarily psychological or mental, but it gets to a point where the chemical in the brain become imbalanced. Sometimes it gets to a point that just meditation, journaling, or different techniques that have been taught to us or told to us, we've kind of passed that. Just a very good example that Dr. Arif just mentioned, and subhanAllah, alhamdulillah, I'm glad I heard that. He said that crazy people don't go to therapists. This is interesting because when was the last time you went to a therapy? And the reason why we don't go to therapy is because I think that some people think that I'm crazy. You're crazy, you need to go to a therapist. Something's wrong with you. You're mentally not okay, so go to a therapist. So he kind of cleared that misconception. If someone is really crazy and they're mentally really off, no therapy is going to really help him, right? Because if you're really at that level of craziness, then you need to go to the hospital and they need to probably admit you for some time. The fact that one can sit through an hour of therapy is an indication that you are at least acknowledging the problem that you have and you're willing to sit and listen to somebody. That is the first step. That is the sign. That is the way forward, right? So many times when we get to that level where it becomes out of control, you don't feel, it's kind of like a person who becomes a zombie, right? You become a zombie, you don't have any emotions. You could be in a place with family, in a vacation, and everything's going smooth and perfect, and the perfect weather, the ambiance, the food, and everything is fine, and there's nothing that you can complain about. Even if you want to force yourself to find a fault in something, even forcefully you try to find fault in something, but even after everything that one can be grateful for, internally you're just sad, depressed, and down, and can't maintain your emotional well-being, and then just, I don't know, right? That's the point where you need to say that maybe it has passed that level of meditation, and maybe we need a professional's help. We need a professional help. It's just like somebody who gets physically wounded. If I cut my hand, if I cut my finger, if I get a bruise, what do I need to do? I need to go to the doctor. I need to get a bandage, and I need to get whatever the doctor medicine he puts me on. I need to get a surgery. And then with that, I need to do dua and meditation and all of the and prayers and supplication. So that's one thing. If one feels that their anxiety and emotional triggers or ups and downs of life is that it's beyond control, then it is important that, just like if I have a headache, if I have a stomach ache, if I have a problem, I would go see a doctor. Your mental health is far more important than our physical health. Our mental health is far more important than our physical health. What is an emotional well-being? I'm going to give you an example of that. And many people might relate and many people might not relate. Emotional well-being, and the reason why I say this is because I had a case about 2-3 weeks ago, and address with a lot of people. Always on the edge. When a person is not emotionally stable, he's always on, either he's too excited, either he's too happy, or either he's too mad, or either he's too upset, either he's too sad, or she. There's no balance. There's no balance. Or he becomes super spiritual. All of a sudden, for 2 days, like starts crying, recites the Quran, starts crying and reading, and then all of a sudden starts praying like for 2 hours. And the next day, there's no salah. He gets emotionally, really emotional about people of Gaza and like, this is wrong and we need to do this. And all of a sudden, he becomes too aggressive and this and that for only 30 minutes. After 30 minutes, he's on to something else. And if he's excited about something, he gets really excited. If he's happy about something, he's super happy. That means that a person is not emotionally balanced, emotionally stable. You're extreme on all ends. Happy, sad, depressed, excited. Everything is just on a high extreme level. There's no normalcy. There is no balance. Is that correct, right? That's emotionally. And then the second part that we were talking about, emotional well-being and mental clarity. Mental clarity, to give you a practical example of mental clarity, is that not able to focus, not able to concentrate, not able to be present in the moment, not able to be present in the moment. And subhanAllah, one time I was driving and I needed to look for a store. And I didn't know where it was. And I searched it up on Google or Maps on the phone. And that store that I was looking for, it was right behind my house. And what do you know? Every single day for the last 10 years, I crossed it, I passed it, I saw it, but I never noticed it. Every time I would pass by it, I would drive by it, I would see the billboard, I would see the sign, but not once did I notice, because I was so lost in my own thoughts and in my own zone that I forgot to notice. And I was searching for it. Man, I wonder where the shop is. I need to go to this place. And next thing you know, it was right behind my house when I searched it up on Google. Right? Isn't that true? How many times we drive around and then we kind of just get lost? It's like we don't know where, I don't know what I ate yesterday. I don't know what I did yesterday. I don't know where I was. If somebody can recall and tell me 2 days ago on Wednesday night at 9:30 p.m., what were you doing? Or let's say a week back, if we backtrack the time. Last week on Friday at 9:30 p.m. around this time. Not exact, or like Friday evening. What did I do last Friday? What did I do last Friday? I can't remember. Who remembers what they did last Friday? I remember because I'm usually in the masjid on Friday nights. That's easy for me. Right? If you're not the regular, who remembers what you did last Friday? Who remembers what you ate last Friday? Who remembers what you ate last Friday? Who remember what you ate yesterday? What did you eat yesterday? Well, kids, y'all are pretty good when it comes to emotional because you're too young, right? But yes, you can tell me, what did you eat yesterday? Pasta, mashallah. Macaroni and pasta, was it good? MashaAllah. Yes? From the adults, we won't remember. We're so lost. We're present, but we're physically present, but our mind is not present. We'll probably be talking to somebody, but our mind is always just like in a rush. We're never really present. You're sitting in a family gathering, you're surrounded with your kids and your spouse and your children in a perfect, nothing to be complaining about, and your phone rings and you have to grab the phone and it just completely takes you off because of one text message from someone who doesn't care about you, neither do you care about them. Right? Could be some random person from work. You're surrounded with family. It could be the most, now your quality family time with your family is completely gone and you're upset. And you're upset at who? You're upset at your family, you're upset at your kids, and your mood is ruined. You can't have dinner, you can't do anything with them. It's almost like we live in an era where even the system that we are in, especially the social media, so much information. 1 minute you're reading about Gaza, and immediately after that, the next ad is about flash sale in rooms to go. Target has an amazing Thanksgiving Black Friday sale coming up. And then you go one more down, 10 people dead in Gaza. And then another, and then there's then another news is about, your favorite jacket that you wanted to buy because winter's coming up, that you were searching on Amazon, and it just pulls up, and then it sends you a message, hey, are you still interested? This is how fast we are going through information. This is how fast we go through information, one after another, and completely disconnection. There's no connection. So our mind is not even able to process, and so we crave that instant gratification. We just want education and knowledge. We don't even want to sit through a lecture where it's like simple. Like we only want to listen to the lecture where it's like deep and talking about deep stuff, as if we've already mastered like the basic stuff such as Tawheed and Salah and Quran, right? Because our mind just craves more and more and more and more. We're not content. Because we've gotten so used to just, when can I have the shipment today? It needs to be Prime. I need it on Prime Day in the next 2 hours. That's true. When I try to order something on Amazon, I would pay $3 extra for shipping just so I can have it tonight. Or tomorrow morning, by the time I wake up, it should be on my door. I'm not gonna wait for 2 more days. I can't wait for 2 more days. And we're paying extra for Prime shipping. Isn't it true? It's true. How many of you have Prime? Everybody has Prime. Everybody has Prime, right? And then sometimes they tell you, would you like to combine to save paper and be environmental friendly? No, I don't. No, I don't. I want my shipment right now. I'm not going to wait for Prime Day, 3 days, and we can combine all of you. No, I want this today, right now. I want it right now. SubhanAllah. Right? This is the system that even the system that we are in, it's designed to give you an overload and completely occupy your mind constantly with different. That's how we become numb. We don't feel, we don't have emotions. When we hear about the people, our brothers and sisters in Gaza and so many parts of the world and dying and this and that, we're just like, sometimes I don't even know how to react. Am I supposed to cry or am I supposed to be happy? Sometimes we become so emotionless because we've been exposed to so much information. I don't know. Even my own senses have lost a grasp. Even internally, I've lost that grasp on myself of how to react to situation. Somebody shares with me a news of somebody passed away, and I made a joke about it. I started laughing. It's not funny, right? Not everything's funny. But I don't know. I'm like, yeah. I'm sorry. That's very true. We don't know. We've lost our own sense of touch on things because we don't know how to react, and it's kind of overload of information. That's why there's certain things, right? So quickly, I'm just going to end with this. I know I said I'm going to finish, inshallah. I was watching one of the video. I was watching a video on apparently YouTube, right? And it was a video about therapists and psychiatrists and psychologists like Dr. Saab. Dr. Saab is pretty hard to get a hold of, so you gotta go online. I'm just kidding. He's very easily available, mashallah. So I was watching about something like this, and this was a guy he was talking about therapy and coping mechanism and stuff, and he said something very interesting. And he was a professional doctor. He was not religious, and his area of expertise and profession was not religion. He's just a regular therapist, psychiatrist. And he was talking about the best ways to overcome these things. And he said, one of the he was a Muslim. One of the greatest formula that we have is salah. Right. And then he went into that, and we hear, and that's how I started in the beginning. We always talk about salah, salah, salah. And the truth is, one can say that, especially during this difficult time, I'm actually praying more than I used to pray before. Right? Isn't it so true that when we are in a difficulty, we actually pray more, we actually make dua more, we actually make adhkar more, but it doesn't seem to help. So this psychiatrist, he talked about salah, but he talked about salah from a different perspective. He said that the prayer of a Muslim, it's integrated in such a way that it gives us continuous grounding techniques. Now, as we were studying about, psychology and stress, especially stress management, there's something called grounding technique. And I talked about this before in my lectures as well. When somebody feels really anxious and he feels that his blood pressure is going up and he feels really stressed out and he's getting angry and he knows that he's losing it. And you know that you're about to lose. So the psychiatrist, the professionals tells us that you need to use something called grounding techniques. For instance, take ice cubes and put ice cube in your hands. It will completely reset, right? Or go in the shower. Or sit down and start taking, put ice cube in your hand, or like the 5 senses, name 5 things, hear, sense, and you can search that up. It's a whole list of things. Or go in the shower, and immediately when you take a shower, especially cold shower, it kind of resets the chemicals or the imbalances in your mind. So this is something called is that correct? Correct me. You were talking about my area, so now I'm talking about your area. So these are grounding techniques, especially when you're really stressed. Now, this doctor who I was talking about the video, he said that salah already has all these. For instance, every time you pray, you have to make wudu. Why do I need to make wudu when my elbow was covered all day long and I was wearing socks all day long? And why do I need to wipe my neck when it wasn't even exposed to any dirt? Subhanallah. My face has been clean. It's not like I'm in the desert or something, or I was outside. I've been in AC and I've been sitting in the room all day long. Why do I really need to wash my face? It looks pretty clean. So wudu, just like taking a shower or taking cold shower, ice cubes in the hand, every time you make wudu, it resets your brain and it gives you a new sense of energy. And that's why many of our scholars, every time they would pray, they would refresh their wudu, even though they had wudu. Even though they may be sitting in the masjid from Dhuhr to Asr or Maghrib to Isha, but when the time for Isha would come in, they would remake wudu again. Especially when we have no problem of water. They would refresh their wudu just so that they can feel that new sense of energy and connectivity with salah. And then when you pray, subhanAllah, and then it's like when you are praying, so this is one grounding technique. When you pray, when you stand in salah, subhanAllah, the different postures that we go through. First, the timings of salah. 5, structured. Second, when you are praying, subhanAllah, the different postures, right? And one of the things that I was talking to, they said that when you practice mindfulness, what are some of the things that you need to do? You need to stretch, and you need to move your eyeballs, and you need to do this, and you need to do that, and you need to take a deep breath and stuff like that, subhanAllah. And they're actually pretty good. In salah, if you are not doing that, and if you're not praying, when was the last time you actually made a point to stand properly with a proper posture and kind of just like stretch yourself, because stretching helps, not just physically, but mentally as well. It realigns the energy in your body. If we pray the sunnah way, making ruku' the sunnah way, what is the sunnah way of making ruku'? You stand straight and your back is straight in such a way. If somebody was to put an apple or a stick on your back, it shouldn't fall. That's how you make ruku', the sunnah way. If you make sajda the sunnah way, there should be such a gap between you, between the ground and your belly, that a baby goat should be able to pass between. How do I make sajda? How do I make sajda? I'm just laying down, right? The proper way of making sajda, that you should be doing it in a way, and when you sit in tashahud, the proper way of sitting in tashahud. Most of us can't sit like that and struggle. We struggle sitting like that. These are things that really open the pores of our body, because, and then it helps us too. It helps us mentally and emotionally. These serve as like grounding techniques. Imagine, they say, the psychiatrist or therapist was telling me, imagine if you were to practice mindfulness just once a day. If you do it every day for 5 minutes, you would see a major difference. Imagine if you do this every day, 5 times a day, just pray properly, sunnah way, the way the Prophet ﷺ taught us to pray. That should be sufficient. That's why Allah Azza wa Jal says, قَدْ أَفْلَحَ الْمُؤْمِنُونَ. Indeed, successful are those believers, الَّذِينَ هُمْ فِي صَلَاتِهِمْ خَاشِعُونَ. Those who have khushu' and khudu' in their salah. Those who have khushu' and khudu' in their salah. And last part that I mentioned, I think it's very important that I want to mention as well. Recitation. When we recite, especially in silent prayers, when we recite Surah Al-Fatiha, Alhamdulillah Rabbil Alamin, what's the normal practice? The common practice. We recite in our head. How do we recite? The proper way of reciting is you move your lips. When you are moving your lips, you can actually feel and sense the words. Most of us just read it in our head and we skim through it, and sometimes we think we read it, but we actually didn't. Right? Alhamdulillah. If not moving, most of us, and I do it all the time, especially when I'm in a rush. Recite Surah Al-Fatiha in the head. Or the proper way is you do it in such a way that you at least move your lips. But not so loud that you're distracting the whole masjid as well. Because that's another problem. Remember, we need to avoid the two extremes. A lot of times when we recite, especially in salah, we recite so loud, Subhanallah, Alhamdulillah, Rabbil Alameen, Ar-Rahman. You're distracting, even the Imam could hear you. Even the Imam could hear you in the front. You're supposed to be reading silently. The point is that other people are not supposed to hear you. But the other people aren't supposed to hear you does not mean that you read it in your head and there's no movement. If there's no movement, you won't feel, you won't have that connectivity with the Quran and with the recitations of Salah as well. So that's why it is very important that we move our lips at least, but still whispering and not loud to a point that other person hears, that we are able to just hear ourselves. That will kind of just make this habit that every time I pray, take this into your habit that every time I will pray, I will force myself to say Subhana Rabbil A'la by moving my lips. I promised you that's going to make a difference. Inshallah, that will make a difference. We ask Allah subhanahu wa ta'ala to accept it on our behalf. I'll conclude, it's getting late, inshallah. Does anybody have any questions for Dr. Sahab? Not for me. Or for me. Anybody has any question? Mm-hmm.
Some of our Muslim people's trend are increasing for yoga and meditation, and that is Indian Indian culture, yoga, China, Chinese, Japanese culture. Chinese, Japanese traditional.
Yes, right.
What is the contrast or similarity with our Islamic perspective?
Right, absolutely, you're right. I think a lot of times we hear these terms, yoga and meditation, and all of these terms in terms of like therapeutic exercises or therapy, and we hear this all the time. From an Islamic perspective, obviously, meditation and yoga are not something that are from our practice, but in fact, our Islam, our religion gives us a better alternative. And that better alternative is that for us, the calming effect meditation is infused into our religion, into our day-to-day life, right? Because we hear these terms and they're advertised in such a way that they sound good and they're more pleasing. But what we do as Muslims, prayer and dua is far more effective. Allah Azza wa Jalla says, "Ala bi dhikrillahi tatma'innul qulub," that surely in the remembrance of Allah do hearts find rest, calmness, and contentment. But the condition is we take the time and we do it slowly and properly. And what is it when if you study meditation, what is the one thing? You need to force yourself to bring your thoughts together. You need to force yourself to not listen or to think about anything. If we can only apply that when we're actually praying, when we're actually reciting the Quran, we do that more than any other culture, any other religion, any other faith, or anybody else out there. But we've just gotten so used to doing it that we've kind of lost touch of it. So bringing about the same practices, but doing so properly. So hope that kind of answers. Yeah. Yes. Yes.
So this is more of a medical question. You indicated that some hormonal secretions happen in the brain. Your slide presentation. For sure, in Salah, in a very strong experience. I'm curious if there have been any studies done to determine what specific hormones and how to trigger those hormones in the brain medically for this issue. I actually am not specifically aware of a specific study that shows that, but there are certain hormones when you are actually praying with khushu. Your brain is able to produce serotonin or even dopamine in certain areas of the brain that actually give you a sense of well-being and satisfaction. That's what I was mentioning earlier, that in your salah, if you have that, find that rak'ah where you are able to focus so much, you actually feel good about it. Whereas if we just kind of go through salah quickly, you feel guilty, you don't feel good about it, right? So I'm not aware of the studies, but I'm not saying that there are no studies done. There's a lot of work that is being done on religiosity, not necessarily Islam, any other religion, and its effect on people's mind or well-being. And there are a lot of studies that have found that people who are sticking to a faith, not necessarily Islam, and they are practicing it, they are emotionally better than people who don't. So for people who don't believe in a God, atheists and people like that, they will always be asking questions and never be satisfied, because they don't have that connection.
Let's take the sisters and then. Yes.
That's your question.
That's a question that's completely irrelevant. You have to ask a question that's relating to the topic. Yes, the topic is mental health. Yes. My advice would be to just cut it. But Dr. Saab can probably.
So actually, there's a really good question. So how do you maintain emotional balance? We talked about several different things that you can actually do to do so, right? So one of the most important things is being content, being thankful to Allah subhanahu wa ta'ala for whatever we have, right? Second is actually, where do most of our problems start? These problems happen because we have some sort of a disagreement with someone. Could be our brothers, sisters, could be parents, could be friends, could be anybody, right? So if we experience this anger or we are upset because we had a fight with someone or somebody said something, if you are able to forgive them and forget about it. Forgetting is more difficult, but Allah subhanahu wa ta'ala does say that forgive and forget. So if you're able to at least forgive them, you'll find that you will be much more satisfied within yourself and much calmer. Is it easy to forgive? It's kind of hard. It takes practice. But if you keep doing it, then it can happen. And remember, Allah subhanahu wa ta'ala is the one who takes care of everything, right? So if somebody really hurts your feelings, then you leave it up to Allah subhanahu wa ta'ala, He's going to do justice. But if you start getting into fights, guess what's going to happen? It's going to go back and forth, and you'll be more, upset, right? Constantly. Who needs that, right? Yes, ma'am. Well, okay, so this is actually Sheikh's territory, but I'll answer. If somebody has a condition that is not under their control, then Allah subhanahu wa ta'ala is forgiving, right? He forgives. So I wouldn't, kind of worry too much about that. Is it going to be accepted or not? You do your best to find the focus that you can, right? Maybe you can recite your surahs a little bit loud so that you can hear it yourself. So that way your focus stays on what you're reading, right? And then the thing with the depression, I always recommend therapy. If therapy doesn't work, some people may have to take medicine because it can run in families. It can be genetic. Or for ADHD, a lot of times, if it's mild, working hard, focusing hard can help you. But when it's severe, then you actually need medication. No, not that I know.
The things that invalidate the salah are very specific. Only those things that invalidate the salah. If it's something that completely a person goes completely insane, or then salah is not even mandatory upon him. Right? Other than that, no. Just regular, like maybe depression or something, or not being present in salah does not invalidate, and you don't have to make up for it. Yes. Yes.
The first one is, I think, made a very interesting point that obviously when people are depressed, they can stop eating or eat too much. They have a difficult time sleeping. Sometimes also you have a problem with mobility. They're not moving. You can also take a nuance, which is take the opposite situation where people are pretty healthy, but they start having sleep problems because they're studying for an exam or something and they keep up for 2-3 days or take certain medication. Or they're not eating right, or they're not mobile because they're working 8 to 9 hours, a problem we see all the time nowadays. And that in itself can also then cause depression as opposed to the other way around. So one of the things to do for those things is just get up and move. Don't sit for 8, 9, 10 hours and also watch your eating and also watch your mobility, because sometimes if you start moving, eating right. Second point I wanted to make was, I think it is important to not undermine the meditation component beyond prayers. And I'm talking about the 5 salah, because we can fill this whole masjid with data on meditation, that relates to mindfulness. And that is beyond prayers, because prayers is very beautiful, and you gotta do that first, obviously, I get that. But mindfulness meditation is a bit different. You're not saying things. In fact, it's the opposite of what you're doing in prayers. You want to focus on not having any thoughts. And I'll tell you, there's so much data on it that people who are having anxiety issues, if they do even 5 minutes of proper mindfulness, it goes away. And I'll tell you one more interesting thing. I think there's a very significant component in Islam for it. We call it muraqabah. Prophet ﷺ used to sit in Hira. He wasn't praying all the time. He was meditating. And the important part about that is, like the doctor mentioned, at night when you're lying down, if you can do this one thing every night, just 5 minutes, look back at your day. So you can do 2 types of meditation. One is when you're thinking as to what you could have done different to better yourself and things like that. How could you be a better person more than you were today? But the second thing you could do is focusing on your breathing and not having any thoughts. The third way, during the day, like we have some ayats in the Quran that mention the ants, that mention the birds. You know, if you just sit outside in the garden and look at the birds and be mindful of what's going on around you, looking at the bird that is trying to court the females, or looking at the ants when they're carrying, looking at the birds when they're making their nest, it relaxes the body, takes away anxiety. And there's so much data on mindfulness that I would encourage everybody to read up on it, do 5 minutes, 10 minutes of that every night. Beyond the 5 prayers, there's a lot of, so we should not undermine that.
Jazakallah khair.
Yes. Inshallah, next in November 7th, next 2 weeks, where our topic is going to be forgiveness and healing, inshallah. That's a really good question. Mashallah. We will have a whole talk on this, inshallah. Yes. Yes.
One of the things that we're seeing, especially in women, and also in some men, is hormonal imbalance that happens after postmenopause. And then you're seeing significant imbalance that is causing severe depression, anxiety, fibromyalgia. I specialize in hormones as well, so I read this all the time. And we have seen, in fact, I just had a patient today, and I had a patient, a bunch of them last week. Their anxiety has gone away, their depression has gone away, their fibromyalgia does not exist anymore. They don't have ADHD anymore because we replaced their hormones. And there are different ways of replacing them. And this is now becoming more popular in psychiatry as well. Psychiatrists, not to say anything about you, doctor, but psychiatrists have been a little bit behind in this, and also the endocrinologists who actually specialize in hormones. But we're seeing a lot of data. In fact, FDA came out just last week or a month ago. Their chairperson said that we've done a disservice to the women with the NIH study, which was incorrect several years ago, telling them not to take it. The hormones that were, and I think it's an important point for the women, that was in that study were actually oral prevalent, which obviously has problems. But now the newer hormone replacement treatments that we have don't have those side effects and are significantly beneficial. And the problem is because this was such a problem with medicine, we had educated the women incorrectly. Now they're coming back taking ADHD medications, being depressed, being severely anxious, because you know what used to happen? When you were 45 or 50, you got menopause. And then you were supposed to die in 10 years. So, you didn't need anything to be miserable 10 years and die. But now women are living up to 100, 110 sometimes. So now you're miserable for 60 years or 50 years. You're anxious, you're depressed. We're giving them SNRIs. We're giving them other medications. We're doing therapy. We're doing all those things. But all we got to do is check their hormones. And I've seen so many of them that once you fix their hormone, all that goes away. So one thing to keep in mind for women, and also for men, it's a problem with testosterone, but that's a separate issue. We see that more in women with their estrogen, especially post-estrogen. Just to keep that in mind from the medical.
So what you said makes perfect sense, and I agree with you on that. Nobody was knocking mindfulness down. What we were talking about was you have to be careful. Certain practices like yoga are their religious practices. During that, they do some chanting, like saying Om and things like that. No, I'm telling you, I've seen it, right? So those things actually you have to be careful with what you practice. You have to kind of stick to your deen, right? So do mindfulness exercise. That's perfectly fine. Nothing wrong with that. But what Sheikh was saying, and that's what I understood from what you said, was if you pray properly, each prayer, You are doing more mindfulness work in 5 salahs, and you can do more rakats. You don't have to just do fard. More sunnah you do, more nafas you do, you're better off. As far as hormones are concerned, 100% agree with you. I've been advocate of this forever, and I think unfortunately problem has been that most of the people who did research on women's issues were men. So, study after study after study with the heart problems, heart attacks, atypical presentation, people not recognizing things like that. Yeah, it happened, unfortunately. And I agree with you, the hormone replacement, even now we are behind. I mean, something as simple as thyroid is missed by doctors, right? And we see it a lot of times, and I know unless you fix the hormone, no amount of antidepressant is going to fix their problem. We see that in our practice. But unfortunately, getting all those tests done, I know of some places where people go to for hormone replacement, and they end up getting actually gypped, because what happens is that now the clinic is selling their own brands of hormone replacements, which costs hundreds of dollars, if not thousands. So yes, I think having more doctors available who know what they're doing, and be able to kind of provide that service is great. I mean, something as simple as melatonin, it's a hormone, right? So, but the thing is that people don't realize it. They start taking too much of it. Too much of that can cause problems too, right? So yes, it's something that I think is relatively new now, I would say, but it's definitely needed for both men and women. Men who have low testosterone, I mean, they can't function either. All right, thanks.
Very good points.
The study last year that came out of Travers that took away all the concerns with a lot of people don't know about this. It was published in 2024. So now testosterone replacement actually has no side effect. They only put something on the label. So they said 3 to 4 point blood pressure increase with testosterone. As far as the other point you made about meditation, I completely agree with you. I mean, I wasn't saying, but yoga or those, I'm not talking about that. I'm talking about pure meditation, 5 minutes of mindfulness. Because you technically cannot have proper mindfulness without meditation. And meditation in prayers is okay, but that's not mindfulness meditation. Mindfulness meditation requires being attentive to the current situation, looking at your surroundings. You cannot do that when you're praying. You have to focus on your prayer and see as if Allah subhanahu wa ta'ala seeing you, or you're seeing Allah subhanahu wa ta'ala, and have that ikhlas. That's just a point. It's a very subtle point, but I'm just saying, I've studied this a lot. I specialize in the area. But I've noticed that a lot of people do that wrong. And I think understand that it is about religion. You do mindfulness meditation beyond prayers. It is called muraqabah. Or you have that. So I just wanted, but I agree with you. This is beautiful, beautiful discussion. So important.
Thank you.
Thank you, sir. Thank you. Yes.
So you mentioned that person had depression, not to repeat this right? All people
So what's your question? Oh, they're not doing salah because they're depressed. No. So I said that one of the conditions of having salah fard upon you is that you have to be sane. Now, if you are not, if you have a for instance, you are, you're not mentally, you're not a sane normal person. Then salah, for instance, if you're not baligh, if you're not mature, for instance, if you're not Muslim, for instance, if you're not in the state of purity, then these are some of the preconditions and the conditions of the salah, right? In order for salah to be obligatory, you have to be a Muslim. Salah is not mandatory upon all. So just like that, you have to be sane. That's what I was saying. Now, a person is Muslim, but he's going through this depression and he's going through stress and he's praying, but he's not present in Salah. He's not able to even concentrate or even recite the words or completely, unless he does not miss the major parts of it. Like for other than that, he does not need to repeat Salah.
I think she's asking about people who don't pray, period.
People who, so you're saying people who don't pray? No, I mean that's the thing. You should pray, but if people who don't pray, it's not an exemption. They're not exempt from praying. Even just because you're depressed doesn't mean you're exempt from praying. It's just like even if you have a physical illness, you still have to pray. Even if you're going to hospitalize, you still have to pray. Even if you have a physical injury, you still have to make up for Salah, right? Yes, depression is not necessarily insanity. If it gets to that level of insanity, then it's different. All right, Jazakumullah khair. May Allah anybody had any else comments, anything, inshallah? If not, then we will conclude. Yes. Good. Okay, Barakallah feek, Subhanallah bihamdi, Subhanakallahumma bihamdik, nashhadu an la ilaha illa anta, nastaghfiruka wa natubu ilayk. Jazakumullah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.